Because you really have to invest.
You're a professor of have you seen that? Yeah? I'm fine with that. Now you can now wait and just have it. Not a month. He was very being to enter the so you can imagine
this machine. Presently, this patient is having this procedure called plasmapheresis. So this we are using saline albumin to do the exchange. It's like exchanging plasma before transplant. So this is the saline albumin, and this is the waste from the machine.
Thank you.
Yeah.
Aderemi Olusegun is my name. It's been challenging. The kidney disease doesn't have respect for anybody. The only thing that you can do to help you is your money. Like this, we've sold so many of our properties because I've been here for the past 9 years. Yes, I have done transplant before. Where the transplant failed during the COVID time. So it's not a disease that an individual can confront. That is why we are appealing to the government to come to our aid. Look at this hospital, Zenith Medical Center. Thank God, God brought people like this. If not, they would have been picking dead people on the road. Dr. Lekon Latishe, the MD of this hospital, he has really tried. Sometimes he gave us free dialysis. It's not easy to do free dialysis because of the consumable things there, because those things are very expensive and they are not producing it in Africa. All the consumable things we use, all those rubber you are seeing, all those items that are moving on this machine, they are all imported. If you spend some time there, you see how they remove them from their pack. You understand? They are all imported. He used to bring container to bring them here. So government should come to the aid of that man and help him. Although he's not the only one in the industry, but he's the one I know. Because since I came since I find myself in these difficulties, it's the only hospital I know. I don't go around and because they are very clean, they are very neat. They try their best. So government should help us. Like for example now, me, I want to do another transplant. I don't have the resources for that transplant. I've been struggling, I've been trying, I've been praying to God to bring somebody to help me so that I can do another transplant, so that I can be free, you understand, from dialysis. You can imagine the first transplant I did after 2 years during the COVID time, it failed. You understand? It failed during the COVID time, and that was 2021. From 2021 to 2026, You can imagine how much I've spent in doing dialysis. You get what I'm saying now? So that is it. If there is any other question you can ask. My name is Aderemi Olusegun. God bless you.
Chinemelum Faith Eze Udo. It's not been easy. My husband has been the one sponsoring the financial aspect of it, but currently he has almost sold everything and he's bankrupt at the moment. So that's it. If I'm begging the government if they can assist me financially so that I can get out of this illness, because it's too much. And it's overwhelming. So if they can do anything for me.
Look, my name is Mrs. Antonia Agada. Wow. Well, it has not been easy. It has not really been easy because since 2024 December, I've been on this journey with my mom, my siblings, friends, families. In fact, there's really no one that has not even supported me, but it's been very difficult. As you can see, my mom cannot talk. She's very weak. She comes for this dialysis twice or three times in a week. So you can imagine the financial situation is taking on me. She just finished her dialysis now. We're about to leave the house. My mother cannot get up from the bed. I change her, I turn her, I feed her, I carry her. On my own part, it's drained me, it's drained my family. I want to appeal to the government to please come to the aid of kidney patients in this country. The old, the young are going through a lot. The financial aspect of it is demanding. If you don't have money to bring your patient, probably the person dies. There are a lot of us going through financial struggle. Bringing our family members, it's not easy with us. It's not easy with us. So I want to ask that the government should support us. The hospital is really doing a whole lot. Zenith Medical has done a whole lot. In fact, if not that I brought my mom here, I'm sure she would have passed away a long time ago. But this hospital has done a whole lot, has helped us. Thank you.
The message will be that we all now need to prioritize kidney health. The prevalence is on the rise, and then we are now aware that 1 in every 10 persons globally has kidney disease. And so for this year, the theme is kidney health for all, and we must all do something as regards prevention, ways at which you can prevent kidney disease, and then early detection, early diagnosis is important so that we may be able to slow down the progression of the disease. As we now know that the treatment is expensive, and then more recently we are seeing that it has an impact on the environment. Renal replacement therapy in the form of hemodialysis has been shown to increase carbon emission from the various plastics that we use for um, as components for dialysis. I mean the consumables for dialysis. They're mainly made of plastics, and we are seeing that one session has a lot of carbon emission that is equivalent to what we see when you drive a car, an automobile, for 240 kilometers. So you can imagine when you do so many sessions in a day. So it has an impact on the environment. Environmental risk factors for kidney disease is real, where people now need to, heat, dehydration, environmental pollution has been shown to be environmental risk for kidney disease. And then for the very first time, the World Health Organization is saying we should prioritize kidney health. Prevention is the key because we can't afford the treatment. So if you cannot afford something, then you have to do everything you can to prevent you from coming down with such disease. And we've talked about, as you can see from our presentations, we talked about all the risk factors that the general public will need to know for kidney disease. Yes. Yeah. Yeah, healthy habits. Yeah, drinking of water, lots of water to make sure you are well hydrated. For those of us that are obese, we try to cut down on our weight. We need to eat healthy. We need to exercise. We need to avoid non-steroidal anti-inflammatory drugs. That's the painkillers that you know. We need to avoid herbal concoctions. There are a lot of herbal medications that people take from all kinds of places. We need to avoid them because quite a number of them are nephrotoxic to the kidneys. We need to avoid the use of bleaching creams, bleaching soaps. They all have issues with they contain heavy metals that can be a problem for the kidneys. And then those of us that are hypertensive or diabetic will need to do regular check by checking their blood sugar, making sure that your blood pressure is controlled. Also, basic tests to detect early CKD by walking into any hospital close to you to run just urinalysis, urine test can help us to detect this disease early. Yes. Okay. Well, even countries with robust economy, they are struggling now to cover that cost, and so they can do a lot. They are. I'm aware that plans are on the way to see how to do more treatment for kidney patients, kidney dialysis or kidney transplantation. Thank you. Well, government can support patients with kidney disease by seeing how we include maintenance hemodialysis in the health insurance scheme for patients, and then also seeing how special waivers can be gotten for dialysis, consumables, immunosuppressants for transplant. If government can subsidize or make it free to patients who have had transplants, that would go a long way in ensuring that they are able to afford these medications and take them and prevent rejection and then prolong the lifespan of the graft. So government can come in those various ways, in medication. Even induction agents for transplants is quite expensive. If it can be, if we can have some level of support on the importation of these medications, that will go a long way for our patients. Thank you.